Over the course of my many years of practice, I've observed what can only be described as an epidemic. Both women and men have protruding bellies. They come to see me, wanting to fix this in various ways. They go on diets, but it doesn't help. They work out, and that doesn't help either. Today, I'd like to tell you that a protruding belly isn't just fat, it's only about a tenth of the problem. Yes, in certain cases, if you go on a diet, your belly will go away. It will get smaller, but there are still many other issues inside the abdomen that can cause your belly to stick out. Today, I want to tell you about these less obvious things and give you exercises that will help eliminate the causes of a protruding belly. Friends, the thing is, our belly is literally a second brain because there are a huge number of nerve endings there that form nerve plexuses. If we look at the anatomy, there is, of course, a layer of fat, and fat does tend to accumulate. But why does an excessive amount of fat cells accumulate in this area? On the one hand, yes, it could be due to hormonal imbalances, and more fat can be deposited in this area. But there's also a mechanism here that's connected to certain tensions in the digestive system. The accumulation of fluid. Why does this happen? The thing is, if we remove the fat apron deeper inside, here is the peritoneum. All of this is the peritoneum. Under the peritoneum are the loops of the intestine. Next, if we remove the intestinal loops, inside there are blood vessels, venous plexuses, and the nerves, shown in yellow, form nerve plexuses. And what does this mean for you? The thing is, if you experience spasms or tension in the abdominal area, it leads to the belly becoming more swollen. It's simply that fluid starts to accumulate excessively. This happens primarily because the abdomen is actually considered the second brain. And any thoughts, any emotions, really any kind of stress, leads to the activation of the nerve plexuses in this area. What does this lead to? The body responds to any stress by activating the sympathetic nervous system. There's this fight or flight response, which increases blood flow to the muscles, to the heart, to the brain, and the heart starts beating rapidly. The pulse quickens and blood pressure may rise. But what happens to the intestines? At that moment, the intestines aren't needed, so they shut down. How does that happen? It happens because the sphincters and the smooth muscles of the intestinal loops go into spasm, because it's a kind of nervous reflex connection. Usually, people are in a state of chronic stress because whether it's family stress, work stress, or physical stress, it leads to spasms and blockages. People are usually under chronic stress. As a result, the digestive system's function is disrupted. A person may feel heartburn, may experience belching, may develop a bitter taste in the mouth, and so on. And of course, all this leads to the intestines becoming atonic, meaning they don't work properly, and peristalsis, that is, the movement of food masses, happens poorly. This, of course, also leads to lymphatic and venous congestion in this area. It accumulates inside the abdominal cavity. Because of this, the abdomen can increase in size and protrude. Even if you start palpating your own abdomen, pressing deeply, you may find some uncomfortable areas there. Let me put it this way. Normally, there shouldn't be any discomfort. That is, the whole abdomen should be soft. Any pressure should feel pleasant. If you feel discomfort, it means your intestines aren't working properly. And not only does your belly protrude, but it also means your digestion is impaired and, most likely, you have poor gut flora. And even if you eat well and take supplements or vitamins, they simply won't be absorbed or digested. I can speak from my own experience. I had this problem as a child. I constantly suffered from gastritis, biliary dyskinesia, and cholecystitis. I was diagnosed with these conditions all the time. I was on diets for years. It only helped for a short period of time. And only when I started working osteopathically with my body and abdomen was I able to get rid of this problem. Because stress builds up over the years. And it sits not only in your muscles and your head, but also in your stomach. So even if you're on diets and working out, have impaired fluid circulation in your abdomen, then sure, you'll get your blood flowing, you'll lose excess fat in other areas, but your stomach will still stay enlarged and bloated. That's why you need to do the techniques I'm going to show you next. Now I'm going to show you what you need to do to get rid of a protruding belly. Of course, there are many different exercises and approaches, and those are important too. Working with the diaphragms, the thoracoabdominal diaphragm, the pelvic diaphragm, and correcting pelvic biomechanics. All of this has a positive effect on reducing your belly. If you want tightened belly and get lifted, younger face, join my rejuvenation course. You can follow the link in description to join. But right now, I want to focus specifically on how to work with the internal organs of the abdomen, with the stagnant processes that are happening here. Considering that our abdominal cavity contains many different organs, and all these organs are connected to each other by blood vessels, nerves, ligaments, and so on. Stagnant processes can occur. I'll show you a simple technique you can use to relax your abdomen in order to improve lymphatic and venous outflow through structures like the mesentery of the small intestine, where the main vessels that supply the intestines, including the small intestine, are located. That's exactly where the most visceral fat accumulates and where swelling processes occur most often. So, if you work on certain points, as I'll show you, you'll notice that your abdomen will become softer, more relaxed, and will start to tighten up. Honestly, this technique doesn't look very pretty because I'll be lying on my stomach, placing my hands, and something will be happening. You won't see anything, but if you try it with me, you'll feel how it works. So, while sitting, I'll explain what we're going to do. You'll place your palm, make a fist. We're going to do a deep pressing of the abdomen. And I think many of you will feel a sense of tension and discomfort inside your abdomen. The only thing is, I ask you not to do this technique if you feel sharp pain, just mild discomfort. Please go ahead and do it. So, what do you need to do? First, you need to place your fist on the area of your solar plexus and lie on it. And then you close your eyes. Relax your abdomen as much as possible, and you'll feel your fist start to sink deeper and deeper into your stomach. Somewhere inside, you'll feel some tension. Just relax as much as you can and breathe. Inhale and exhale through your fist, letting go of the tension. After that, move your hand to the area of your navel. Place it right where your belly button is, because the mesentery of the small intestine is projected there. This is the key structure we need to relax. The more relaxed this area is, the better your stomach will start to tighten up. Next, place your fist right above the pubic symphysis, above the pubic joint. Here, you're already affecting the organs of the pelvis, and even the stagnant processes that are inside the pelvis. These are the 3 points. Next, in the same way, you can move your fist to the right iliac fossa, where the ileocecal valve is located. That's the transition from the small intestine to the large intestine. This is also a key, important area. Then you can move higher, under the right costal arch, and do the same thing. Over here is the left iliac fossa, where the rectosigmoid colon passes through. This area often reacts to stress, and there's always some spasm there. Just place your fist there and lie on it, and also move upward. So, in total, you get about 5 to 7 points that completely cover working with the abdomen. So, let's do it. You'll need to place your fist in the area of your solar plexus, and put your hand down. Then you lie down and relax. You might feel a pulsation. There's nothing to worry about. Just relax and wait for this area to loosen up. It's enough to observe this area for 1 to 2 minutes, and then move on. So, you lie down and place your foot. Just like this, lie down and relax. Try to relax your body as much as possible so that your fist sinks deeper and deeper, all the way to the spine, as if you're touching your spine. And somewhere deep inside, you might feel different kinds of tension. If you feel a tense area, just start breathing, taking a deep breath in, and exhale into that area, and relax. Do this for a minute, 2, or even longer. After that, move your fist a little lower, right to the navel area. There, place your hand on your navel and relax as much as possible. Relax your stomach and you feel how your fist starts to sink deeper and deeper. If you completely relax your stomach, you'll notice some tension there. There might be some pulsation, and that's normal. Just breathe into that area and relax. Keep doing this until all the discomfort goes away. Do this for about 2 minutes as well. After that, move your hand lower, just above the pubic symphysis. And right above the pubic symphysis, you might notice that if you relax your stomach, there can be some tension coming from the pelvis, and you might feel a slight discomfort. Again, breathe and relax. This technique, where you place your fist and lie down, is like you're pressing out all the stagnant fluid there, and all that tension goes away. And your stomach will just start to tighten up because the excess fluid in that area will be leaving. After that, you move your fist to the side, first to the right iliac fossa, then you can place your fist higher, under the right rib cage. And of course, don't forget to breathe. Take a deep breath so you're breathing right through the tension. This is a pretty simple technique, but it's actually really effective. You can do it on the floor or on a bed, but it's better to do it on the floor because you need a firm surface for the best effect. And now you work on the left side for that you need to switch fists. So now it should be your left fist, and you place your left fist in the left area now. Then we move it down as well. And exhale all the tension, relax. Gradually, you'll feel your stomach become softer and more relaxed. And that's basically it. If you do this exercise almost every day, you'll notice your stomach getting softer, the pain will go away, and the heaviness in your stomach will disappear. This will improve your digestive system, and your stomach will also start to tighten up. I work with muscles, fascia, the skull, and of course, with the internal organs. And there are also plenty of deep osteopathic techniques you can do to enhance the result. But for that, you need to have special skills and knowledge, so if you're interested, join my rejuvenation platform, Mind Body Face. This was Dr. Alice with you. See you next time.